Yeah, but yes, guys, today our Free Friday seminar is with Dr. Nicolas Streitenberger. He's assistant professor in the San Bernardino campus, and today he'll be presenting about pathology of ruminal acidosis in cattle. Yes, the floor is yours.
Thanks, Ariel, for the introduction, and thanks everyone for attending today on this Free Friday seminar. As Ariel introduced me, I am Nicolas Streitenberger, one of the pathologists at the California Animal Health and Food Safety Laboratory System, and I'm also part of the Pathology, Microbiology, and Immunology department at UC Davis. I wanted to apologize in advance for this delay, but yeah, we're having some technical issues this morning. But yeah, it's basically this seminar. It's gonna try to hit the main points associated with a disease that I'm sure many of you have been working on, either on cases, on consultation. So the discussion is gonna go all around ruminal acidosis, but specifically trying to see what are the main pathologic findings associated with the disease. So this is my team at CAFS. Particularly, I am based in Southern California, in the branch in San Bernardino. So this is part of the team and some other members of our CAF system. And the main sources for this talk are going to be our classic literature. So the JKP, the veterinary medicine book, Zachary, and a bunch of articles that I think are very useful resources to check for this disease and how to get the diagnosis of the different form of ruminal acidosis. So it's going to be a combination of this classic literature plus this work and this project that I have the opportunity to work with this fantastic group of colleagues mainly from CAS, but also from Argentina and Chile, where we were trying to characterize better and compare the two main forms of the disease, acute ruminal acidosis and subacute ruminal acidosis. So the talk is going to be a combination of a brief introduction of and definition of the classical definitions of acute ruminal acidosis and subacute cases. We're gonna talk a little bit about the etiology and pathogenesis, some of the sequelae of subacute cases. So that's gonna be a brief introduction. And then we are gonna move on to the second part of the talk, where I am basically gonna try to highlight the main points of this project that we did. And I'm going to wrap up the talk with a few take-home messages that I think are important for pathologists and diagnosticians in general. So just get started. And the first things when we think about ruminal acidosis is how we're going to define that, and how we're going to specifically define the two forms of the disease. And that immediately put us in a position where many parts and steps of the pathogenesis for the acute form and subacute form they have some similarities, but there are also big differences as well. As you can all tell, and you probably all know, this disease, ruminal acidosis, is caused by this excessive fermentation of feedstuff in the reticular rumen compartment of cattle. And I didn't say that, but we're going to mainly focus this talk on cattle. Only a few comments about small ruminants, but it's going to be about cattle, ruminal acidosis in cattle. So an extremely common disease. This excessive fermentation translates in drop of the ruminal pH that usually goes lower as less than 5.5, and that's our part of our case definition for when we consider a case of ruminal acidosis, no matter or regardless the form. And not only that, but there's also in this disease increase of BFA. So those volatile fatty acids are going to increase. Sometimes the lactic acid will increase as well, especially if we are talking about acute forms of the disease. And we're going to see how the osmolarity of that rumen content is also going to go up. And there are going to be several changes when it comes to the microbiome of this rumen fluid. And so we definitely know, and the two main forms of the disease are well defined from a clinical standing point, and clinicians and nutritionists, they have a really good understanding and definition of what they consider an acute ruminal acidosis versus a subacute ruminal acidosis. When it comes to pathology, I think we also are able to recognize when lesions tend to, are more associated with acute cases or subacute to chronic, but we don't have a very strict definition of, about those two particular forms of the disease. And that's, I think that's definitely was the starting point for our project. We wanted to have a better understanding of what pathologic changes characterize one form versus the other one. So we definitely put together that project based on this knowledge gap. The pathogenesis, and I'm going to start with the acute form of the disease. It's a little bit different to a subacute, even though, as I said before, there's many steps that are sharing between both forms of the disease. But basically, what happened when you have a case of acute ruminal acidosis is an accident. It's usually one event, those animals that somehow they have access to a barn or a place where they have access to unlimited or large amounts of carbohydrates, high concentrate diets, but they usually tend to be one or few events in a short period of time. That's how it starts. So that translates or produces increase of this BFA, which it's gonna be, at least at the beginning, the main driver for that drop of the ruminal pH. And then one of the consequences that we know that happens when that ruminal pH goes down is that we started to see changes in the microbiome. Some of the microbiome, it's usually a combination of several bacterial genera in the rumen, but it tends to be more predominantly gram-negative. And when the rumen goes down to 5.5, gram-positive bacteria, such as Streptococcus bovis, started to proliferate. And those bacteria are going to increase the concentration of lactate. And lactic acid, it's a very important step for the pathogenesis of the acute form of the disease. And that lactic acid, it's gonna keep contributing to the reduced ruminal pH to the point that it can get like less than 4.5, even 4 in acute cases. And below that 4.5, other floral lactobacillus, they're gonna increase, which is gonna keep increasing the amount of lactic acid as well. But if you can see here in this diagram, what it increases is the acid lactic and not the L form, and we're just gonna check on that in a second. But keep that in mind. That is the lactic acid, the one that is starting to going up after the lactobacillus populations increases. All right, so with that, this acidosis not only takes place in the environment of the rumen, but also in the internal media of these animals. So we have a metabolic acidosis. We keep increasing the BFA. This is particularly important for more the subacute form of the disease, and to some degree to the first steps of the acute form. But they mainly are the main drivers for the subacute form of ruminal acidosis. We're going to touch on bacterial endotoxins and how they can impact other tissues and organs. And the rumen osmotic pressure goes up. That means that a lot of that fluid from the internal media, they're going to go to the lumen of the rumen contents, and that's going to cause dehydration. All right. So this briefly, a very brief explanation of the pathogens in the acute form. And this is a really good point. I just told you about the D-lactic acid, and it actually, both isoforms of lactate, they're produced by bacteria when there's acute ruminal acidosis. But we have a lot of enzymes. Mammalian tissues have a lot of enzymes, these type of dehydrogenase that can metabolize easily the L isoform of lactic acid. The problem is that the D-lactic acid, you have a different metabolic route, and this an enzyme is not as affected, at least, than this one when it comes to metabolize this type of this isoform of D-lactic acid. So, this is ended up being the one that gets accumulated the most in cases of acute ruminal acidosis. And I just want you to keep that in mind, that every time we are discussing about increases of lactic acid, it's because we are talking about the acute form of the disease. The lactic acid is not a main component or a main driver of the pathogenesis in subacute ruminal acidosis. So, and I think I love this definition. This is for one of the papers that I listed. When an animal is still alive, you have opportunities to take several samples, and including blood samples, or you can test the ruminal contents as well. And this is how a nutrition and or a clinician define acute ruminal acidosis, like a metabolic status where there is decrease of blood pH and blood bicarbonate, and there's increase of this D-lactic acid in the rumen. So all of these measurements can be taken if the animal is still alive. Once again, and trying to answer our knowledge gap, but many of these samples we're not going to be able to, or many of these parameters we're not going to be able to check when we are dealing with an animal that a carcass that we got on the floor. All right. And now we're switching to the pathogenesis of the subacute form, and it's once again it's going to be associated with diets that are rich in carbohydrates. But the main difference with the other form is here we're going to have multiple events. So this animal is going to have access to those concentrate diets multiple times. And so that means that ruminal pH is going to go down to the normal range. So it's going to be an ruminal acidosis, and then it's going to go up again to a normal limit. And then so we're going to have those peaks of normal, on and off, normal, abnormal, low ruminal pH. So that's one of the main things, and I think that's important to keep that in mind for when we start in the lesions. We also have increase of BFA, and we're going to check and talk about how butyric acid have some impact and causes some proliferation of the ruminal epithelium. So we definitely have, similar to what we described in the other form, we're going to have decrease in ruminal pH. But everything is going to be, the VFA are the one that are running the show here, not the lactic acid. And that's something really, really important to remember. So this is a disease that takes place in weeks or even months. And mainly we see this form of the disease in fetal cattle, but also in dairy cattle. And many of those highlights that we have here in the box are the one that we comment on the other form. We're gonna see here, differently to the other form, some changes in the epithelium because of the chronicity of the process. We're not going to have a lot of impact on the pH of the blood pH, but we're going to have some other consequences when those bacteria get into the blood supply and can reach other different organs. We're just going to talk about that in a sec. So this is the other definition, and once again, clinically, or nutritionists, they have a really good understanding, and this is the definition. It's well understood and characterized what subacute ruminal acidosis is. Also, they describe or define this as the intermittent boost of low ruminal pH during weeks or months, with a variety of non-specific clinical signs and changes that they're usually most commonly associated with the four stomachs, but we're gonna see, or we're gonna just talk about a potential sequelae that this form of the disease can also cause. And here's once again what we're gonna try to answer or explore with our hypothesis and paper. Sequelae from the subacute form of the disease. This is probably the form of ruminal acidosis that it causes more economic losses. And as you can tell, when you have increase of that ruminal osmolarity, a lot of internal media and fluid, they go to the ruminal contents, and those animals, they present with diarrhea clinically. Also, the motility, it gets affected. And the animals also, because of that diarrhea, they present with dehydration, which can be quite severe. One of the most common sequelae when it comes to the ruminal wall is parakeratosis, and you probably have heard about this, how that ruminitis, it gets chronic, and there's a lot of increase in the corneal stratum of the ruminal wall. And here's an example of how those ruminal papillae looks like, with this kind of shortened and kind of like have this matted appearance of the ruminal papillae. And this is a close-up view of the same ruminal mucosa. If you look at the color, also it tends to be like dark green. And this is how it translates on histo, with papillae that tend to be shorter. And we have increase of this corneum stratum. We still see the nuclei, so a severe parakeratosis here and epithelial proliferation. And as I just mentioned before, butyric acid in these cases of subacute ruminal acidosis are the ones that stimulate the most of this epithelial proliferation, because they trigger mitosis, but they also inhibit apoptosis in these cells. So that's one of the main reasons why we see very proliferative lesions, like very severe epithelial proliferation in this form of disease. Another sequelae includes a potential fungal infections on the ruminal wall. And this is how it looks on gross examination. There's multifocal, sometimes coalescing, well-defined areas, kind of circular, or irregularly round sometimes, with the center of necrosis, kind of green, dark, and they're surrounded by this more pale rim, which ultimately it is circumscribed by this hyperemic area as well. So this is the serosal aspect of the ruminal wall, and we can see this beautiful mycotic plaques. Now, a question for you guys. Can anybody in the chat tell me for this mycotic ruminitis, which one would be the most common fungal infection? A, B, or C? We can make this a little bit. Okay, Natalie vote for A. We have more votes for A. I like that. Great, great. Perfect. Anybody else? All right, A is the winner, and you are absolutely correct. A is the right answer. Well, can anybody name one of the genera, or what kind of fungal organism you will expect to see there? any species that you can remember, or a group of Mucor, Rhizopus, all your zygomyces, Absidia. Those are the most common ones that are associated with mycotic ruminitis in cases of ruminal acidosis. A fantastic job for the ones that were participating in the chat. And they're characterized by this morphology. So B was a case of the structure of aspergillosis. C was a pheohyphomycosis, but definitely all your zygomyces, they have, as you can see in picture A, this bulbodilation. They have non-dichotomous branching, and they tend to be thicker when you compare with aspergillus. And so, and they're septated, but they're paucis septated, so they don't have a lot of septae. So good job with that. We'll move on to the next possible complication of chronic or subacute ruminal acidosis, and you definitely probably heard about liver abscesses and how common those liver abscesses can be detected when you have a chronic acidosis case. And we actually, it's one of the tools that we use at the slaughterhouse to check for ruminal acidosis. We count the liver abscesses in order to monitor how's the prevalence and incidence of the disease in feedlot, for instance. But those bacteria, so that means that ruminal wall got somehow more permeable and allowed bacteria to get the blood supply and reach different organs. But not only the liver, you can also see bacterial infections involving the heart, kidneys, and even the lungs. I'm going to show you a few pictures of that. This is an abscess in the liver of a cow that have chronic acidosis. This is an embolic pneumonia with this focal areas throughout the pulmonary parenchyma, very dark red. And when you cut it through on the cut surface, you can see how the center, they have this kind of creamy, thick exudate that when you look at histo, they're mainly those suppurative infiltrates are mainly focused on the vasculature. So you can see here an airway. This is nothing to do with the pathogen that coming through the airways. This is arriving to the lungs through the blood supply. So you see these vessels with a lot of neutrophilic infiltrates and cellular and nuclear debris in a classic case of embolic pneumonia secondary to ruminal acidosis. This cow also have liver abscesses when I did the necropsy. So it's common to see a combination of all of them. Another case where the chronic ruminal acidosis was associated with bacterial endocarditis. You see the thrombus, big thrombus on this right atrioventricular valve, very big cauliflower-like lesions in that right atrioventricular valve. Another possible complication of this form of disease include polyencephalomalacia and the pathogenesis of this. Can anybody in the chat tell me why acidosis can trigger polyencephalomalacia? If you remember, you feel like typing. Or which vitamin it is involved in the pathogenesis of these lesions? Yeah, thiamine deficiency, correct. That's absolutely correct. So vitamin B1 or thiamine, it's produced by bacteria in the rumen. The normal flora produce that vitamin for ruminants, and when we have that shift of microbiome, which is basically driven by the acidosis process, we started to lose that bacterial population that produced that synthesized that vitamin. So we have lower levels of thiamine, and that triggered polyencephalomalacia, which on gross examination, it's characterized by these areas of necrosis, affecting the cortex mainly, and the frontal parietal lobes mainly. You can see here under a UV light how those areas of necrosis and malacia are highlighted in this kind of like more bluish kind of fluor color. And then on histology, this is on top of the images are the meninges. Down here you have the white matter. The process affect mainly, at least at the beginning, the deeper layers of the cortex, of the neuroparenchyma. So mainly gray matter, and particularly have this kind of laminar form of necrosis in the gray matter, affecting the more deeper layers of the cortex. Perfect. And thanks for interacting there. Low vitamin B1, this in the chat. Perfect. That is absolutely correct. And then another possibility, and I think this is the last one that I include for as a complication of this form of the disease, include problems in the hoof and laminitis, similar to which is described in horses, some similarities with the pathogens in horses, but in ruminants, especially if in chronic cases of ruminal acidosis, you can see this hoof overgrowth, mainly due to the rotation of the distal P3, and you know, when you look at the solar part aspect of this hoof, on the left you have a normal animal, on the right you have an animal with chronic acidosis. The main lesions, and at least at the beginning, are going to be, as you can see, the closer you get to the coronary band is when you're going to see more areas of swelling and potential inflammation associated with this entity. And I really encourage you to, when you have outbreaks of this, to look for early lesions associated with acidosis, because that's exactly the anatomic place where you wanted to see the early changes and associated with the coronary band, that swelling, and sometimes they started to have like a little bit of edema, and ultimately that even if it's severe enough, they can detach part of the hoof. Yeah, really important to pay attention to the coronary band, at least in early lesions, because once these get infected with secondary bacterial infections, this is going to be very tricky to differentiate from an intradigital pleural hepatitis, you know, which it's also very common in these type of systems where we usually see acidosis, right? Like the dairy cow and fetal cattle. All right, here are all your possible sequelae from chronic cases. So just to briefly summarize what clinically, and I emphasize this once again, I think clinically these two forms of the entity are well defined. Of course, you will see mainly clinical signs in the acute form, sometimes in the subacute. They usually die when it's acute form, not when they have the chronic. The ruminal pH, there's several. When it comes to cutoff of ruminal pH, there's so many different sources, but you know, something that is below 5.5, I think it's a reliable threshold to consider that an animal has ruminal acidosis. Lactic acid, remember, every time you hear this word, you're talking about acute ruminal acidosis, and BFA, mainly running the whole process when it comes to subacute to chronic forms of the disease. Bacteria, I'm not going to talk a lot about this, but we mainly describe that Streptococcus, Lactobacillus, but many other bacteria. When you look at studies of microbiome, there's a lot of bacteria that these are the two more well known, but there are many other bacteria that are also increase in number when animal have acidosis. And as we said before, if the animal is still alive, you have the opportunity to measure the pH in the blood and the bicarbonate and even lactic acid. So all these are excellent tools when you are dealing with an animal that is still alive but is showing clinical signs or not, and you want to check for one or the other form of the disease. All right. And now that leads us to the second part, of these this talk, where we definitely keeping this chart in mind, what we were wondering is like what can contribute as pathologists, to differentiate these two, what kind of parameters we can check on, and that's when we put together this project, and I'm gonna just walk you through briefly, and then I'm gonna make a few comments about diagnostic confirmation, and touch on differences or variation of ruminal pH after death, and a few differential diagnoses of the disease. So the objective of the paper was quite straightforward and short, but very concise. We really wanted to characterize and compare the ruminal acidosis lesion, ruminal microscopic lesions, and the acute form of the disease and subacute. And we only included cattle in this first project. We only studied 52 animals, and you can wonder, like, why between 91 and 2020 you have only 52 cases to look at it. We've been very, very strict when it comes to the inclusion criteria. We only include animals that were submitted by veterinarians and they have a complete clinical history, not only about the clinical signs, but also the type of food that those animals were receiving. So that led us with a number of 52. We only include animals older than 6 months, mainly to get rid of all the acidosis and ruminitis associated with younger categories like ruminal drinking, completely different diseases that can also cause ruminitis. But we wanted to get rid of all those cases, to just focus on this entity. So all the animals more than 6 months with a ruminal pH less than 5.5. 28 of this were part of the group acute and 24 subacute. We include 7 animals with no clinical signs associated with the GI and that die from a completely different disease and have normal ruminal pH. So here in our control cases, we have animals that die of nitrate toxicity or oleander, other causes that they have nothing to do with the GI issue. We did also look at the many features associated with the ruminal mucosa and ruminal papillae. We look at the number of those papillae, the length, the width, the thickness of the ruminal epithelium, and the thickness of the stratum corneum. And we did we used this statistic analysis, a linear model, mixed model, using this software. So here just a few pictures to show you, all the measurements, the length, the width, and the different thickness of the ruminal epithelium and the stratum corneum that we were measuring. These are 3 softwares we use it for image, and on the left, the one that we use for image analysis. This is a free software. This is for the statistical analysis, and this one to create a graph they're gonna see now. And ancillary tests run in these cases include Arabic culture from liver and lung, a complete diarrhea panel with culture from a small large intestine, testing for salmonella, and testing for Clostridium perfringens. These 3 toxins were tested from small intestinal contents. We checked for BBD, and we did check for parasites as well. As part of our routine diagnostic workup, a heavy metal screen and vitamin testing was also included. And not all of them, but a big chunk of these cases also were tested for oleander and nitrates because of the sometimes the presentation, especially in the acute form of the disease. It's they usually are animals that are just drop dead or they have sudden death. So this is some of the testing that we usually run in animals with a history of sudden death. And just to give you a background and some information about how our study population looks like in the 3 different groups. This is the acute group, subacute ruminal acidosis group, and controls. When it comes to sex, they were fairly equally distributed between females and males, maybe a little bit more males in the control group. They were all animals over 20 months. and around 340 for 100 kilograms were the body weight. When it comes to breed in different groups, it was a mix of different, beef, but also dairy, cattle. But I will say majority of these cases, they were beef breeds, beef cattle. All right, these are the clinical signs that the veterinarians included in the clinical history. This is a summary of what they saw in acute cases. So if you look at 18 of those 28 acute ruminal acidosis cases, was just sudden death. They didn't see anything, and only 10 of those 28 they showed some clinical signs, but it was like less than 24 hours duration. Depression, anorexia, lethargy, diarrhea, bloat, dyspnea, dehydration, hypothermia, those are aggressive behavior, some of them. So those were some of the clinical signs that they saw in the acute form. In the subacute group, the clinical signs, they were more than a day. They usually were subtle. We know that subacute cases, they usually have subtle clinical signs. Sometimes you even see them. So these animals die from a different cause of the disease, disease, right? Like this, the cause of death could have been pneumonia, or they usually don't die of the disease. But we have, in huge economic losses. Sometimes they saw intermittent like bloat going on, or diarrhea that was like on and off. So those some of the clinical signs that they were comment on the subacute cases. When we move up to the findings on the floor, gross examination revealed in both cases, in both groups, abdomens that were extremely distended, and this distended rumen with all these congested vessels. And when we open it up, we, in this case, was a case with those large amounts of wheat in the ruminal contents, and this kind of fluid that it's also present as part of the ruminal contents. But we actually see like a variety of different feed stuff in these cases, not only wheat, but also corn and other source of carbohydrates. When we check on the mucosa, specifically these patchy areas of reddening and the submucosa, were by far more common in the acute group, 46% versus 25%, and the subacute form. And when it comes to these outer chains that we mentioned before, this matted appearance of the ruminal papillae and this decrease in length of the papillae, those is definitely more commonly seen in the subacute group. Reddening of the mucosa of the abomasum was also common in both groups, and only in the acute form of the disease we saw a blood line. So we did not have any record of this bloodline present in a subacute group. And I'm just gonna comment very briefly about esophageal bloodline, pulmonary congestion and edema, briefly, by far 3 times more common in the acute cases versus the subacute, which is expected. But when it comes to the bloodline, and I hope this paper will be out soon, we put together a very simple survey. Many of you probably already completed this survey with 9 questions. Almost 200 vets participate in this. And the main take-home message that we have from this survey, this includes acidosis cases, but also other causes of bloat. So, keep that in mind. Most of the veterinarians consider that it's most useful in cattle when they have to compare with goats and sheep. More commonly observed in fetal bloat than in non-bloat deaths. Only 3%, they say they always or usually see these in cases that are not bloated, so very, a low percentage. And they also said, a majority of them, they said that the bloodline is supportive, but rather than a definitive diagnosis of blood. The present alone by itself, almost 83% of the beds should, they said that this lesion alone should not be used as a diagnostic of fetal bloat. And the absent does not rule out bloat. That was another big percentage of the contestants. And many people also believe that this line fades as the postmortem, goes along. All right, going back to our study of ruminal acidosis, this is probably one of the hallmarks that you always are hunting when you have slides and you wanted to, rule out or confirm a case of acidosis. So definitely these intracorneal pustules in the epithelium on the left in an acute case, on the right in a subacute form of the disease. And as you can see, they're basically neutrophils in the epithelium forming these pustules, but the size of these pustules, the number of neutrophils that you see, it's quite different when you look at these two different forms of the entity. And just to give you like a very brief comment on this, if you look at the acute form, almost 80% of this animal in total, they either have no micropustules in the epithelium or they have just a few. And when I say a few, it's in some cases less than 5, and they're very small. So really, really easy to miss these lesions in acute form. I just took a picture of A here of the most florid one of the acute group, but it's something that definitely can be missed in a diagnostic routine. Whereas when you're dealing with subacute lesions, definitely pustules tend to be bigger and more numerous. So a very characteristic neutrophilic ruminitis in a subacute form in the picture on the right. All right. When we did special stains, this is a stainer stain. You can see how the highlights mainly cocci, a few also bacilli, but mainly cocci proliferation within the superficial epithelial layers of the rumen. And when we do a gram stain, they're mainly they're gram positive and mainly cocci, although some rods as well. But mainly gram-positive cocci is what we saw, especially when you're looking at acute ruminal acidosis cases. Possible complications, we already show a gross image of this zygomyces. You already answered this question, and the arrows are just pointing out how those fungal organisms, they really dependent on oxygen. So it's very common to see those profiles of organisms within the vessels, and these are two profiles of vessels with completely occluded by fibrin, showing that thrombosis. And the whole mucosa is expanded, very edematous with a lot of hemorrhages. And here a GMS stain to highlight those fungal organisms within the lesions. And as we said before, findings that we always see associated with subacute cases of acidosis. All right, and now I have another question for you guys to see if they're still awake. I'm sure that you all have seen these changes in the ruminal epithelium. So is it baculation of ruminal epithelial cells has diagnostic value? Yes, no. Yes, but in acute. Yes, but only in subacute cases. Yes, but in both, or none. Can anybody vote on the chat? And believe me, you can guess. I didn't know about this. It's something that I found very interesting when I started studying these changes. Oh, someone is typing. Okay, someone vote for D question mark. Okay, I like that. Anybody else? Oh, someone voted for A. Okay, wow. if you would have asked me this a year ago, I would have voted for A as well. So anyways, oh, we have more people typing. Let's see. Okay. Oh, we have another vote for D. Perfect. Okay. Yeah, D is absolutely correct. And these are called balloon cells, and this vacuolation of the more upper stratum, the granulosum stratum, those layers, and also you can see them in the corneum stratum. They're definitely a change that, especially when you're dealing with acute ruminal acidosis cases and you have nothing but just a low pH, is something that you feel very tempted to give it credit to, because there's almost like zero morphology changes, and it's definitely something that you wanted to say, this might just be part of the, like triggered by that acidic environment. But these are actually cells that are described in the literature like cells that are part of the maturation of the ruminal epithelium. So please don't be like me a year ago when I was just putting this description in my reports. So it's just part of the normal maturation. This is some of the studies that's been done in that, and we actually in our study noticed the changes in the acute cases, subacute, but also in the controls, that they have nothing in the rumen. So definitely something to consider when you're looking at the histo, so you don't misinterpret those changes. All right, this one I'm gonna just go very briefly, but as you can expect, if it's a subacute form of ruminal acidosis, you will see you can see coagulative necrosis, especially in those mycotic lesions, epithelial ulceration. And then when it comes to infiltrates, inflammatory infiltrates in the lamina propria and submucosa, they're definitely more prominent in cases of subacute versus an acute form. There's no time in this acute form of the disease to, release all the cytokines and call those neutrophils to come over. There's no time. Those animals die in less than 24 hours usually. So they usually have like very mild infiltrates there. This slide includes the main findings of our histomorphometry for the different ruminal measurements we took. One of them, as I mentioned, we check out the length, and the length of these ruminal papillae were shorter in both groups, acute and subacute, when we compare with the control. But even though that looks like a similar result for both groups, they represent two different stories. And this is really nice to, it's interesting to discuss this, because in those acute cases, you have shorter papillae because you have an epithelium that's not been exposed to a lot of VFA, and so there's nothing that is telling the epithelium you have to increase your number of epithelial cells and develop your ruminal papillae. There's no stimulation by the VFA. Whereas in the subacute cases, we actually have a lot of VFA, and they're the one that is causing the main driver of acidosis. It's just those chronic lesions and that corrosive effect of that chronic ruminitis is the one that makes the papillae shorter. And so even though they both look shorter when compared with the control, they're representing two different stories, if that makes sense. When it comes to the width of the papillae, the wider were the subacute ruminal acidosis cases, and partially that increase in the width of those papillae has to do or is connected with the increase of layers of the ruminal epithelium. When we look at I'm going to just put these two together because I think it's a nice comparison. When you look at the thickness of the epithelium and stratum corneum, you can see that the bars, when you see both graphs, are kind of similar. Definitely a thicker epithelium if it's a subacute case compared with the acute cases and control. But when you look at the thickness of the stratum corneum, they were they were thicker than the control, but they were not different with the acute form. So what this means basically is that a lot of the thickness, increase in thickness that we see in subacute ruminal acidosis cases is mainly given by the increased number of epithelial cells and the granulosum stratum rather than the corneum stratum, which for me was quite mind-blowing. And then the other thing you can highlight from these four graphs is like the lack of morphologic changes in acute cases. The only reason, the only parameter where the acute cases they were different from controls was just the length of the ruminal papillae. Other than that, they look like exactly like a control case with no lesions. And if you have any questions about this, I can talk for hours. This is amazing. I love this morphometry stuff. But even though I feel like this slide has to be included, last night I decided to include it because we actually did not play with the pH, because our inclusion criteria was animals lower than pH 5.5 are included in this study. The rest, we don't care. We need to know that we're dealing with ruminal acidosis when we put together the inclusion criteria. But I feel like I have to say something about it because it's something that we deal with every day when we try to diagnose this disease. And this is one of the few references that I actually found of what happened after death. Everything is perfect when the animal's still alive and you need to measure that pH, but what happened after death? And this paper did not find when in what season this study was done, if it's summer, I don't know, that was not specified, but it has really nice information about the variation after death in the first 24 hours. And you can see none of these two groups that they were comparing, so forget about the groups, none of these groups have acidosis. So the good thing, there's like two main points here to take. One is like the pH kind of keeps stable and went up a little bit in hour 6. And then it came, it started to load down again to almost reaching to the initial point of ruminal pH at hour 24. And the other group, this kind of like similar behavior when it comes to the variation. So that's one thing. The other thing that I think is very interesting is like none of these animals with normal pH when they die, because the one is 610, the other one started around 560. None of them became acidotic enough to be considered ruminal acidosis based on the ruminal pH. So this is the only source I can find. If someone has any other one, just please share that with me because I would be very curious in knowing. But at least this is some. We don't know how this translates in different seasons throughout the year with different temperatures. The fermentation can be different or different diets, but at least this is, I think it's a good starting point. All right, we're getting close to the end, but I didn't want to forget to talk about differential diagnosis when it comes to the acute form, and it's basically any cause of sudden death. And there are probably many other diseases that I didn't include here, but other toxicosis, heat stroke, even enterotoxemia, they're all fair game when it comes to differential diagnosis of the acute form of ruminal acidosis. Can anybody in the chat, if someone's still alive after an hour, tell me what is the main toxin we have to test to rule out enterotoxemia in cattle or in ruminants in general? I'm going to give you 3 options: alpha, beta, or epsilon. Oh, now we have people type in. C. perfringens, yes, perfect, Erin. Yes, absolutely. We want to rule out C. perfringens type D. That's the cause of enterotoxemia in ruminants. Do you remember which one is the main epsilon? Perfect. Someone put epsilon in the chat, and that's the one of the which is for the 3 toxins usually as part of our panel. But epsilon is the the one that will give you the confirmation of enterotoxemia caused by superfinches type D. All right, in cases of neutrophilic ruminitis, other causes that should be considered, this is just a few differential, but I'm sure there are more BVD, and that's why we test all our animals for BVD. They can cause exactly the same intraepithelial neutrophilic infiltrates in the rumen. So keep that in mind, especially if you're dealing with a case where the pH is not supporting your diagnosis. If it's a young animal and you have any problems in the ruminal groove, that milk can go to the ruminal rumen compartment and can ferment there and also can trigger acidosis. The usually younger categories, they're still milking. So that's called ruminal drinking, and that's another very common cause of neutrophilic ruminitis. Poisonous plants, this Baccharis, it's a plant that is mainly present, we don't have it in the US, but it's present in South America. And believe that in Argentina is still causing severe issues, especially in the Northeast. But it's also present in Brazil and other areas of South America. And lead arsenate poisoning also can have neutrophilic or cause neutrophilic ruminitis. So keep this in mind when you're dealing with these lesions, because we definitely want to consider ruminal acidosis, but it can be also other entities as well. This is just a picture to show you how that plant looks like. Baccharis currifolia. Lesions can look exactly like a case of ruminal acidosis. So just to wrap up this and write 2-3 conclusions about this paper, we definitely rely on ruminal pH when we have to reach the diagnosis of the disease, but we really want to also give that context with the pathologic findings, really important for both forms of the disease. When it comes to morphology, shorter and wider ruminal papillae and thicker epithelium are the hallmarks for subacute ruminal acidosis cases. And when it comes to the acute form, remember, the changes are going to be subtle. They only differ from a healthy animal because they were shorter. And if you're lucky, you will see a few pustules, intraepithelial pustules. So very subtle. And the fact that these were shorter, I think we discussed this in the paper a little bit. These probably one of the predisposing factors why those animals died, because they have no, the papillae were not developed enough to absorb all those VAF. And I'm happy that at the end of the day, we tried to come up with a chart similar to what I presented for the more clinical point of view, with the gross lesions and showing how blood can be a large quantity of fit stuff present in both forms. The reddening of the submucosa, especially in the ventral side of the rumen, were more common in the acute cases. The matter appearance and shortening of the ruminal papillae were most commonly seen in subacute. Esophageal bloodline, if you find it, great. If you don't find it, don't rule out that in any of the forms. Will be very uncommon to see in a subacute case. Pulmonary congestion and edema, definitely by far more common in acute cases. Histology, you really are gonna try to look for micropustules in the epithelium. If it's a subacute, you'll find plenty of them. If it's an acute or they're not present, that doesn't rule out the case of acute ruminal acidosis. And we already just mentioned these two changes about the length, the width, and the thickness of the epithelium, and keep in mind that inflammation will be, of course, more flooded in subacute cases. With that, some of the future directions that you can see with the rumen histomophrometry is that it can be a really good complement tool for the monitoring of subacute ruminal acidosis at the slaughterhouse, along with other tools like liver abscesses counting and ruminal epimural bacterial community assessment. So those are some of the potential value that I can see, not only for diagnosis, but also to check the health status in a herd of when you want to check for subacute ruminal acidosis. with that, thanks everybody for being here today on a Friday, and for listening and participating on the chat. I will be happy to take any questions, or if anybody has any comments or any input or experiences with the different forms of ruminal acidosis.
Hey, Nico. Good morning.
Hey, Robert.
Sorry, I couldn't join earlier. I had some problems, so thank you for this amazing presentation. So let's see, anybody has a question for Nico? Can you comment on the pathogenesis of a mineralization in the superficial stratum corneum?
Huh. I think I've seen that, and I think I know what you're referring with that. I I I think that change is mostly more associated with diets that they don't have enough fiber, um, but usually bad quality diets is what I've been told when I've seen that change. Um, I definitely remember seeing that on the floor, and I think I consulted someone last year because it was not a case of acidosis, and you see the mucosa kind of clumped and forming this kind of like clamped, groups of papillae, have a very particularly gross appearance. And I think that when I did histo, it did have parakeratosis, but it also had mineralization, and it usually, I think, is associated with poor quality diets. That's what I remember discussing with Dr. Zal.
People are typing. What will be the cause of the blackish coloration that appears in the subacute form, I suppose?
I believe that that's mainly because increase of the epithelium thickness, not only the corneum stratum, but mainly the granulosum stratum. That's my understanding.
I mean, it says that, okay, thank you. Onisto is often just individual cells in a thin layer. Okay, any other question? So, Nico, quick question.
I understand that comment, but it's often just individual cells.
It's regarding the mineralization.
Okay. Thank you, Emily, for that input.
So, I have a question myself, Nico. Could there be acute cases of ruminal acidosis with chronic lesions associated with a different underlying condition? I don't know, bovine viral diarrhea, and leading to a bad diagnosis of chronic acidosis when you actually have an acute case with another condition. It's that. What do you think about that?
I think it's as biology. I think that it's possible to have a twofer where you have potential cause of ruminitis driven by acidosis, but also have a viral infection like BBD, and I think that's one of the main reasons why we always check any of these animals for BBD. But I think definitely it's something I would, if you have doubts, or if you can test for at least BBD, I think that's something to definitely consider.
So I suppose that the clinical history for that also is relevant, right?
Yeah, absolutely.
Thank you. So any other question? If not, we can call it a day. And thanks our beloved friend Nico Streitenberger.
Yeah, thanks again, Roberto and Davis-Thompson for inviting me. And for all the people that helped me with this project. There's a lot of people that contributed, made huge contributions. So a big thank you for all of them.
Okay, thank you so much, Nico. Thank you all for assisting this amazing seminar, and I'll see you in future seminars. So have a great weekend. Thank you, Nico.
Thanks, everyone.